And already tired teams of disaster workers and first responders are getting ready to head back to the Gulf Coast to help with relief after Hurricane Zeta. That's right after they got back from helping with Hurricane Delta. The Limestone Baptist Relief Team is just one organization getting ready to head south from North Alabama. They'll work closely with other groups helping out to form a coordinated effort. They expect to focus on cleanup like tarping roofs and removing fallen trees.
Schools across North Alabama are already responding to the threat of severe weather tomorrow morning. We learned a total of 14 school districts will operate on 2- or 3-hour delays tomorrow. As we get updates from more districts, we will run them across the bottom of your screen and post them on our website, awaytv.com. Huntsville is doing its part to help potential victims of this storm by opening a livestock shelter. The Alabama Department of Agriculture and Industries opened a facility at Alabama A&M University. The shelter is only for livestock, not dogs and cats. Space is available on a first-come, first-served basis. Owners will need to bring their own feed and other necessities. For all the latest updates on severe weather, as well as 24/7 access to the Storm Tracker Early Warning Radar Network, download the Storm Tracker weather app today.
Turning our attention now to the coronavirus pandemic, the CEO of Crestwood Medical Center said right now is a challenging time for hospitals. There are currently more than 1,000 coronavirus inpatients across the state, and that is up 176 since last week. Inpatient numbers haven't been this high since August. Here are the current numbers: 162 coronavirus inpatients in the Huntsville Hospital Health System. 40 are in the ICU, 12 are on ventilators. 74 of all inpatients are in Madison County, 34 at Decatur Morgan Hospital, 20 are at Marshall Medical Centers, 16 are at Athens Limestone, and 13 are at Helen Keller Hospital.
New this evening, we are learning more about how hospitals are managing a surge in coronavirus inpatients during flu season. Today, the CEO of Crestwood Hospital says it is starting to see more hospitalizations after traveling and social events at the beginning of the month. WAY 31 Sydney Martin joins us live in Huntsville. She learned how hospitals are handling the spike. Sydney.
Dr. Pam Hudson, the CEO of Crestwood Hospital, told me that the hospital activated its surge plan back in March when the pandemic began. She said when there's a spike of cases, it puts pressure on the entire system. Now, fortunately, she said the supply chain for PPE has stabilized since March, so they don't expect to run into a shortage. But Hudson explained one of her biggest worries is fatigue among doctors or nurses. She said the pandemic led to long shifts and some employees not being able to take time off. Hudson also said during the current surge, hospital leaders are meeting daily to make sure they're prepared and have a plan for staffing or hospital beds.
I would guess that most hospitals are reviewing their surge plan, which is we've already surged into, most hospitals have COVID specific units that in the past we wouldn't have had patients in a special unit like that. So we're already, I guess, technically at a bit of a surge, but on a daily basis, you know, we're one discharge, 2 discharges away from having to do something more strenuous than what our sort of level 1 and level 2 plans are.
Now, Hudson didn't go into detail about what the next levels of a surge plan do look like, but she did say that that's on the community, that's on the hospital, and not the community to manage. But she did say the way that the community can help healthcare workers is by staying separate, wearing a mask, and sanitizing. Live in Huntsville, Sydney Martin, WAY 31 News.